Hi guys, today we are going to talk about diabetes. More than 37 million adults have diabetes, and 1 in 5 of them don't know they have it. Diabetes is the 7th leading cause of death in most part of the world. Diabetes is the number 1 cause of kidney failure, lower limb amputations, and adult blindness. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled. Diabetes is a chronic, long-lasting, health condition that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body doesn't make enough, or any, insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause health problems. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. Sometimes people call diabetes a touch of sugar or borderline diabetes. These terms suggest that someone doesn't really have diabetes or has a less serious case. But every case of diabetes is serious. Over time, that can cause serious health problems, such as heart disease, vision loss, and kidney disease. There isn't a cure yet for diabetes, but losing weight, eating healthy food, and being active can really help. Other things you can do to help: take medicine as prescribed. Get diabetes self-management education and support. Make and keep healthcare appointments. There are 3 main types of diabetes: type 1, type 2, and gestational diabetes, diabetes while pregnant. Type 1 diabetes. Type 1 diabetes is thought to be caused by an autoimmune reaction. The body attacks itself by mistake. This reaction stops your body from making insulin. Approximately 5 to 10% of the people who have diabetes have type 1. Symptoms of type 1 diabetes often develop quickly. It's usually diagnosed in children, teens, and young adults. If you have type 1 diabetes, you'll need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. Type 2 diabetes. With type 2 diabetes, your body doesn't use insulin well and can't keep blood sugar at normal levels. About 90 to 95% of people with diabetes have type 2. It develops over many years and is usually diagnosed in adults, but more and more in children, teens, and young adults. You may not notice any symptoms, so it's important to get your blood sugar tested if you're at risk. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes, such as losing weight, eating healthy food, being active. Gestational diabetes. Gestational diabetes develops in pregnant women who have never had diabetes. If you have gestational diabetes, your baby could be at higher risk for health problems. Gestational diabetes usually goes away after your baby is born. However, it increases your risk for type 2 diabetes later in life. Your baby is more likely to have obesity as a child or teen, and develop type 2 diabetes later in life. Other types of diabetes. Less common types include monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis-related diabetes. Some rare forms of diabetes result from mutations or changes in a single gene, and are called monogenic. Monogenic forms of diabetes account for about 1 to 4% of all cases of diabetes. 1, 2, 3, 4 In most cases of monogenic diabetes, the gene mutation is inherited from one or both parents. Sometimes the gene mutation develops spontaneously, meaning that the mutation is not carried by either of the parents. Most mutations that cause monogenic diabetes reduce the body's ability to produce insulin, a protein produced in the pancreas that helps the body use glucose for energy. Neonatal diabetes mellitus, NDM, and maturity-onset diabetes of the young, MODY, are the 2 main forms of monogenic diabetes. NDM occurs in newborns and young infants. MODY is much more common than NDM and usually first occurs in adolescence or early adulthood. Most cases of monogenic diabetes are incorrectly diagnosed. For example, when high blood glucose is first detected in adulthood, type 2 diabetes is often diagnosed instead of monogenic diabetes. If your healthcare provider thinks you might have monogenic diabetes, genetic testing may be needed to diagnose it and to identify which type. Testing of other family members may also be indicated to determine whether they are at risk for or already have a monogenic form of diabetes that is passed down from generation to generation. Some monogenic forms of diabetes can be treated with oral diabetes medicines, pills, while other forms require insulin injections. A correct diagnosis allows for proper treatment and can lead to better glucose control and improved health in the long term. In people with cystic fibrosis, the thick, sticky mucus causes scarring of the pancreas. This scarring prevents the pancreas from producing normal amounts of insulin. So, like people with type 1 diabetes, they become insulin deficient. Their pancreas still makes some insulin, but not enough to keep you healthy and maintain good nutrition. So according to the 2019 CF Foundation Patient Registry, about 20% of people with CF have cystic fibrosis-related diabetes, CFRD. CFRD shares some features with both type 1 and type 2 diabetes. In addition, people with CFRD may not respond to insulin in the right way like people with type 2 diabetes do, especially sick, taking steroid medication, or pregnant. This is referred to as being insulin resistant. The goal for managing CFRD is to keep your blood sugar, glucose, at normal or near normal levels, and to keep up with normal nutrition. Your CF and diabetes care teams can help you successfully manage CFRD. Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. Approximately 96 million adults, more than 1 in 3, have prediabetes. Of those with prediabetes, more than 80% don't know they have it. Prediabetes puts you at increased risk of developing type 2 diabetes, heart disease, and stroke. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. Prevalence has been rising more rapidly in low- and middle-income countries than in high-income countries. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation. Between 2000 and 2019, there was a 3% increase in diabetes mortality rates by age. In 2019, diabetes and kidney disease due to diabetes caused an estimated 2 million deaths. A healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use are ways to prevent or delay the onset of type 2 diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, and regular screening and treatment for complications. Key facts. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. Prevalence has been rising more rapidly in low- and middle-income countries than in high-income countries. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation. Between 2000 and 2019, there was a 3% increase in diabetes mortality rates by age. In 2019, diabetes and kidney disease due to diabetes caused an estimated 2 million deaths. A healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use are ways to prevent or delay the onset of type 2 diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, and regular screening and treatment for complications. In 2014, 8.5% of adults aged 18 years and older had diabetes. In 2019, diabetes was the direct cause of 1.5 million deaths, and 48% of all deaths due to diabetes occurred before the age of 70 years. Another 460,000 kidney disease deaths were caused by diabetes, and raised blood glucose causes around 20% of cardiovascular deaths. 1. Between 2000 and 2019, there was a 3% increase in age-standardized mortality rates from diabetes. In lower middle-income countries, the mortality rate due to diabetes increased 13%. By contrast, the probability of dying from any one of the four main non-communicable diseases, cardiovascular diseases, cancer, chronic respiratory diseases or diabetes, between the ages of 30 and 70 decreased by 22% globally between 2000 and 2019. Over time, high blood glucose leads to problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, foot problems, gum disease, and other dental problems, sexual and bladder problems, diabetic neuropathy, low blood glucose, hypoglycemia. Early diagnosis can be accomplished through relatively inexpensive testing of blood glucose. Treatment of diabetes involves diet and physical activity along with lowering of blood glucose and the levels of other known risk factors that damage blood vessels. Tobacco use cessation is also important to avoid complications. Interventions that are both cost-saving and feasible in low- and middle-income countries include blood glucose control, particularly in type 1 diabetes. People with type 1 diabetes require insulin. People with type 2 diabetes can be treated with oral medication, but may also require insulin. Blood pressure control, and foot care, patient self-care by maintaining foot hygiene, wearing appropriate footwear, seeking professional care for ulcer management, and regular examination of feet by health professionals. Other cost-saving interventions include screening and treatment for retinopathy, which causes blindness, blood lipid control, to regulate cholesterol levels, screening for early signs of diabetes-related kidney disease and treatment. Lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes. To help prevent type 2 diabetes and its complications, people should achieve and maintain a healthy body weight, be physically active, doing at least 30 minutes of regular, moderate intensity activity on most days. More activity is required for weight control. Eat a healthy diet, avoiding sugar and saturated fats, and avoid tobacco use. Smoking increases the risk of diabetes and cardiovascular disease. Hope this video was educated enough, and you have learned a lot. Thanks for watching. Please make sure you subscribe, share, comments, and don't forget